Hello, everyone, and thank you so much again for attending our Mental Health Mondays. We are here with another community partner from IVAT, and she will be speaking on the effects of the coronavirus on mental health. Linda?
Okay, go ahead. Hello, everyone. My name is Linda Tellotson, and I am a doctoral student at IVAT, which is the Institute of Violence, Abuse, and Trauma. Today, I'm going to talk about the effects of the coronavirus on mental health in the United States population. Most of us have grown familiar with the virus known as COVID-19. And probably the picture that I have in this slide is a very well viewed picture in the past 3 years. Why is it called corona? Well, it looks like a crown. The only difference is that it has lots of spikes where the picture alone could make someone be afraid, and because the spikes looks just like thorns, and people would be reminded about what kind of bad things that could happen to them. So I think that's one of the reasons, is that people could be compliant if the picture that is being depicted is ominous. Not too many has predicted and suspected that this virus, not too many has predicted and suspected that this virus would survive globally this long, and is still going on as we speak. It has affected most areas of life, facets of life, physically, psychologically, economically, and emotionally. It has altered people's lifestyle, behavior, even the environment and other aspects of daily existence. The spread of the infection was so rapid that the world was caught unprepared. Despite the precautions, the vaccinations and other intervention, it is still causing death daily as we speak. As of August 29, 2022, the global confirmation of infection was 599,293,387. And this is the population as of that time in 2020. The population of the world was 7.8 billion, and 6,481,405 died of the infection. In the United States, which has the population of 330 million, the people that were infected was 94,028,125, and 1,043,089 died of the infection. In California, which has the population of 40 million, 11,054,444 were infected, and 94,913 died of the infection. In San Diego County, which incidentally is the second largest county in California, it has 3.1 million in population. 978,572 were confirmed as infected, and 5,456 died of the infection. And this data was from the Center for Disease Control. So what is COVID-19? COVID-19, or the coronavirus disease, is a disease caused by SARS-CoV-2, which, according to the Wikipedia, is a severe acute respiratory syndrome that infects humans, other mammals, including livestock, things that we eat, like cow meat or pig's meat or things like that, companion animals, our dogs, and avian species, our birds, and which undergo frequent recombination and replication. So that is important to know. This explains why we are going through variants of the virus at this time or as of right now. The signs and symptoms of the illness could appear from 2 to 4 days. For others, it could be more, which is called the incubation period. Some symptoms that we need to be aware of are fever, cough, tiredness, shortness of breath, chills, muscle aches, sore throat, runny nose, nausea, pink eye, and headaches. As you could see, it could resemble a common cold. So a few victims of the virus died because they were not hitting the symptoms and they thought it was just a common cold. Some people also might not experience any symptoms at all. Others, especially older people with comorbid illnesses, such as perhaps hypertension, heart problems, or diabetes, could be seriously ill and expire or die from the virus. So, what are the effects on mental health? One of the effects is that it increased the rates of anxiety and stress in our daily functioning because of, first of all, unemployment. The rampant spread of the virus altered the employment situations of the employers, especially in the field of agriculture, restaurants, child and adult care, public services such as schools and other public institutions. As we know, some of us know, or not all of us knows, that a lot of restaurants were closed because of social distancing. Agriculture that produces our daily subsistence, such as rice and other necessities, closed because the employees were also might have caught the disease, or because of social distancing. Children had to stay home, and the elderly has to stay home as well and fend for themselves. Financial security was threatened. Food and shelter was unstable. So there was a lot of stress. Problems with balancing the new normal life of home life, working, taking care of the home and children, and all of this under seclusion is very stressful. There was an increase in rates of domestic violence and alcoholism, drug abuse and suicide. And this data is according to the Harvard Medical School in 2020. Relationship problems became worse with the whole family at home, and no place or people to contact when arguments arise between family members. There was a shortage in police response because of some policemen who also contracted the disease, and also because of social distancing. Those families with a propensity for physical domestic violence suffered the most. Child abuse increased, and the severity of injuries required more hospitalization. There was also an increase in children's exposure to child abuse. Mental health services were not readily available due to social distancing, financial issues, and shortage of services. Some families turned to drinking and using drugs to help them cope with the situation. Those that were already drinking drank more, and those that were using drugs used more. The fears of the pandemic, the lack of coping skills, and the use of drugs increased the rates of suicide. Also, the devastating loss of someone to COVID-19 and not being able to do anything about it, the helplessness, the guilt of not being there when their loved one expired at the hospitals, added to the suicidal thoughts. Actually, in some areas of the world, there was mass burial of the victims of the virus, and some actually the bodies were burned so that to just kind of press the exposure of the virus to the population. Loneliness, the feeling of lacking needed social connection, also contributed to the suicide rates. We are social beings, and having no one around us was very lonely. Solitary substance use led to increase in suicide among adolescents, and this data is according to the Kaiser Family Foundation. And the reason is that the adolescents like to use drugs with their peers, with their friends. And now, especially the addicts, they're forced to use by themselves. So consequently, there's no help if in case they overdose. So the suicide, some of the suicide is because of accidental overdosing. It also led to depression of some of the population, being bombarded with sad, depressing news all the time from the news media was depressing. The lack of treatment, not being able to go to resources, the isolation, being alone, the loss of jobs, being unemployed, the economic situation. It was very depressing to know that some things, some necessities are not available. The lack of resources. Most mental health services were trying also to cure whatever is going on in their organization and reorganizing into telehealth. Shortage of professionals due to social distancing. Some of the professionals themselves were also infected with COVID-19, so they were not available. The lack of family activities such as family gathering for birthdays, weddings, funerals, graduations, and other important events are no longer feasible. These activities used to be happy activities, and it's no longer there. Produces depression. And also, there were no avenues to express emotions. There's no one to be able to consult when they are emotionally disturbed. There are positive impacts despite of the negative impacts of the COVID-19. Clearly, according to the Penn Research Center, April 2021, the negative impact of COVID-19 outweigh the positive impact. However, as it goes on, the population learns from its errors and ways and changes actually for the better, as we are now. Prior to COVID-19, the elderly health was not prioritized. Despite of the increase in the elderly population, elderly health was not too much of a priority, and this is according to the Generations Journal of the American Society of Aging in their article, Living Longer, that was published in April 2022. Also, the health insurance companies were not able to actually go with the increase in the population of the elderly. Also, one of the positive impacts is it builds relationship. As the family got isolated and only have contact with themselves, they were able to develop more coping skills in improving their relationships. Another positive impact is technology. They were able to discover and develop their talents in using the technology, especially those that work from home. The ITs or the companies, experts are no longer available temporarily, so they have to be their own troubleshooters. So they learn more about technology. The population was able to practice better hygiene. Families became aware of better hygiene practices, such as washing hands more often, using alcohol and other safe chemicals to protect themselves from contracting the disease. These chemicals are also available in public places. So people were able to be aware that they need to do it. They need to comply. Innovations. The families became innovative in staying connected, being able to help others by using technology such as Facebook and other media avenues. They were able to socialize that way. Education also became digitized and affordable. Prior to COVID-19, person-to-person classes were expensive. With the online access, it became less expensive. And this is according to the Sparrow survey of 2021. You and your mental health. According to the Kaiser Family Foundation of 2022, based on economic downturn and social isolation, additional deaths due to suicide and alcohol and other drug misuse may still be occur up to 2029. So we need to take care of ourselves. Some of this could be due to worsening chronic conditions of health. Again, as I mentioned earlier, hypertension, diabetes, and other comorbid illnesses. And there's also the shortage still of mental health professionals. And then the solitary substance use, not being able to get some help if there is an overdose would contribute to suicide. So I made up a to-do list of self-care strategies to connect your body and your mind. For the body, get enough sleep, go to bed and get up at the same time. Be aware of your internal clock. Be compliant to your internal clock. Participate in regular physical activities such as dance, simple enough, dancing, exercise, walking, maybe just walking around your area, and yoga. Eat healthy. Eat a well-balanced diet. In California, we are lucky enough to have access to fresh fruits and vegetables. Take advantage of it. Limit your caffeine intake. Avoid tobacco, alcohol, and drugs. And relax. When you feel overwhelmed, recharge your batteries. For the mind, reduce your stress triggers. Keep your regular routine. You have a new normal now, different from prior to COVID-19. So be aware of that new normal and be compliant to your new normal. Limit exposure to the news media. Social media could affect one's sense of reality. As an example, when the COVID-19 started, and it started in Wuhan, China, there was actually a lot of speculation about germ warfare, the power supposedly of China in inventing this germ warfare. So there was temporary discrimination against Asian. So, and also stay busy. Do things at home or do things around your home. Even just simple gardening would keep you busy. Read books that you haven't had a chance to read before. Keep your mind busy. And above all, focus on positive thoughts. That's my presentation. Thank you. And do you have any questions?
Excellent. Thank you so much. This was very informative. I love how you have tangible tools and tangible tips of what people can do to stay busy, and how staying busy and focusing our mind on positive thoughts and gardening and just doing other things such as reading can be helpful. So thank you so much for this insightful and useful presentation. And we will